So we do have 3 new cases confirmed overnight, 2 of them in hotel quarantine. 1 person recently returned from Iraq, the other from Afghanistan, and we're all used to that process now. Then the 3rd case is a lady in her 50s who travelled up from the Northern Beaches on the 16th of December. She flew up on Virgin Flight VA925, arriving into Brisbane Airport at 9:30 a.m. We are currently contact tracing the rows in front of where she sat, behind and either side, so that's happening. But anyone who was on that flight should, if they develop any symptoms at all, immediately get themselves tested. As I said, we are contacting those people who are most at risk, but anyone on that flight should come forward and get tested if they have any symptoms at all. She then got a hire car and travelled to 8 Mile Plains and went to lunch at the Glen Hotel. So anyone who has attended the Glen Hotel after 11:30 a.m. on the 16th of December, if they develop any symptoms at all, should immediately get themselves tested. Again, we are contact tracing people who did attend lunch, who we are most concerned about, but anyone who went to the Glen Hotel restaurant after 11:30 a.m. should monitor themselves and immediately come forward and get tested if they have any symptoms. The lady then travelled to the Sunshine Coast, and we're contact tracing there. She went to a hotel but only had contact with the receptionist, so we're working with that receptionist. Otherwise, she didn't have any broad contact there. She then travelled, stayed overnight, Sunshine Coast, then travelled through Brisbane to return home to the Northern Beaches, and she went into the Prince Charles Hospital and got tested for COVID because a friend of hers let her know from Sydney that the issue was developing there. So she got herself tested and then travelled on to Sydney and is now back in Sydney. That test result came back positive last night, and so we started all that contact tracing. And I'm confident that we are broadly contact tracing and we will find anyone who's potentially at risk of having come into contact with that individual. But the message remains exactly the same as it has always been. Anyone in Queensland today who has any symptoms that could be related to COVID-19, so broadly any symptoms, should immediately come forward to one of our many testing sites across the state and get tested. Now, because of this rapidly escalating cluster in the Northern Beaches, we're now, as we heard, at 28 cases, and we expect that there will continue to be more. I have declared the Northern Beaches area of Sydney a hotspot, and as of 1 a.m. tomorrow morning, anyone who has been in that area on the 11th of December or subsequent to that date will need to go into Government Hotel quarantine for 14 days when they arrive into Queensland. So that's all been put in place. Until that is in place, we will be issuing orders to people that they need to go into home quarantine for 14 days from when they left the Northern Beaches. So anyone in Queensland today who has been in the Northern Beaches from 11th of December onwards, any date, needs to immediately go into quarantine wherever they are. So in their home or in their friend's home or in a hotel, wherever they are in Queensland, and they need to organise to get themselves tested. That's very important, and they need to stay in that quarantine site wherever they are until it's 14 days since they left that Northern Beaches. Now, that police will be working through to see how we can find people, but essentially I'm relying on people to do the right thing, and we know from the start of this pandemic that Queenslanders overwhelmingly have done the right thing, so I ask them that they continue to do that. Now, as we go into this period, we know there is more mixing happening, and that's what is so great about Christmas, about this holiday season, that friends and family all get together. We just have to continue to be really cautious. We have to be sensible as we go through these next few weeks. This is a rapidly evolving situation in the northern beaches and could well expand through other parts of Sydney. So here in Queensland, we have to be ready. So people, please, when you go to those venues that have QR codes or have processes to check contact details, it is critically important that you give them your contact details so that if we have something happen, we can immediately contact people and get on top of clusters as quickly as we can. That is really important. And I also ask everyone, wherever possible, maintain that 1.5 metre distance. Really maintain that distancing and be alert to yourselves. If you've got any symptoms, come forward and get tested. We've got testing clinics throughout the state and they will, of course, be operational all through Christmas, the holiday season, New Year. This time is a real risk for Queensland as we see what goes on in Sydney.